The status of COVID-19 in the country, the government has reiterated its commitment to ensuring that the welfare and safety of all healthcare workers is guaranteed. Chief Administrative Secretary in the Ministry of Health, Dr. Mercy Mwangangi, disclosed that the medical practitioners will especially have unlimited access to quality personal protective equipment during this period. But that is not enough, as Mwangangi says the ministry will address all the concerns raised, including ensuring provision of medical cover and mental health support during these difficult times. The assurance coming at a time when 580 more persons tested positive for the coronavirus, pushing the country's caseload to 29,334. Nancy Okware breaks down the latest figures.
Health workers in Nairobi County have issued a strike notice, citing salary delays and lack of personal protective equipment, among other things. Their grievances appear to have reached the country's top echelons, given that the matter took center stage during the daily update on the coronavirus situation by the Ministry of Health. The Chief Administrative Secretary in the ministry, Dr. Mercy Mwangangi, acknowledged that the concerns are genuine and that the government was working round the clock to ensure they gain access to quality protective gear to guarantee their safety in the line of duty.
COVID allowances have been paid for all staff in Nairobi County. We have the records to demonstrate this, and these allowances, we have confirmation from NMS that these were paid. So the healthcare workers should remain confident that they will get the PPEs that they need. Additionally, we've put in place mechanisms, and we continue to encourage each and every healthcare worker, should you come across a PPE that you feel is defective in any manner, our doors are always open. My door is always open. Come in with that kit, and we shall take the necessary action.
All donations which are coming here are subjected to a quality test to ensure that they are meeting the standards. So any donation that is coming and doesn't meet the standards, we don't take.
The CS further disclosing that a budget was in place to ensure health practitioners have full access to medical cover during this period of crisis.
A budget is available to cover them. 2, last week, that's on the 7th of August, negotiations were initiated at NHIF, and these are due to be completed within the coming week to ensure that these healthcare workers actually receive an enhanced cover under the civil service scheme.
The concerns by health workers coming at a time when the country's COVID-19 tally hit 29,334 after 580 more cases were confirmed from 5,458 samples tested. Nairobi had 375 cases, followed by Kiambu with 53, Machakos 23, Busia 17, Mombasa and Nakuru 15 each, while Kisumu had 12 cases. 198 patients were declared free from the virus, with the highest number being those from home care program.
119 are from the home-based care program, whereas 79 have been discharged from various hospitals. And this therefore brings the total number of recoveries in the country to 15,298.
On a sad note, however, 5 patients succumbed to the virus, pushing the total of fatalities to 465. With the healthcare workers being the first line of defense against COVID-19, the Ministry of Health says that it is doing all it can to address their issues, among them provision of quality personal protective equipment, alongside establishment of networks aimed at addressing their mental issues. Nancy Okware, Channel 1 News.